Roger C. Peace Rehabilitation Hospital is collaborating with Clemson University's International Center for Automotive Research, CUICAR, and with DriveSafety, the leading provider of clinical driving simulators, to advance the state-of-the-art in simulation-based tools for patient care.
Nice to meet you. I'm Bree. I'm one of the OTs. I'm going to be working with you today.
Leveraging simulation technology, Roger C. Peace has expanded its range of treatments and care in both its driver rehab program as well as in its general occupational therapy practice.
Now let's look at all the possible locations where the E's will appear.
These tools are great in occupational therapy because of how they exercise patients' sensory, cognitive, and physical abilities that are essential in activities of daily living. This helps therapists pinpoint functional deficits and provide engaging therapeutic activities for recovery. DriveSafety's CDS 250 simulator has been designed, tested, and tuned in close collaboration with expert clinicians. It has a complete driver cockpit for easy, comfortable entry and exit. Patients of almost any size can be accommodated because of the hugely extended seat range of adjustment.
The technology behind the simulator is amazing. Having the 3 screens and the partial cab really allows the patient to be in the experience of driving. They get a feel for what it is to get back on the road. It definitely makes a huge difference than just looking at a monitor on a computer screen.
The most impressive aspect of this system is the comprehensive library of clinical activities that it provides. This collection of diagnostic and therapeutic programs is called SimClinic. It addresses a wide range of patient skills and abilities, including many that are appropriate for general occupational therapy.
That's like having a toolbox of activities that we can pull from, and we can definitely tailor those for our patient's need and for their level of expertise and demands.
Benefits for the clinic include enhanced occupational therapist evaluation with interactive exercises that provide objective patient performance measures in many areas of vision, cognition, physical functioning. The DriveSafety SimClinic library of clinical treatment programs includes dynamic activities to improve functional performance in key areas such as physical strength, reaction time, control, and endurance. Development of cognitive skills to improve attention, memory, and problem solving. Visual perception and information processing, visual motor integration. Neuromuscular reeducation of movement, coordination, posture, and proprioception. Training for ADLs, assistive technologies, adaptive equipment.
You're going to look at the image. When I turn the page, you're going to have to remember how to. As therapists, we're always looking for different variety of activities to work with our patients. The CDS 250 driving simulator allows us to work with more dynamic activities instead of always working with paper and pencil activities. A little more active than the paper and pencil, but before the simulator is the vision coach, and it allows us to work on dynamic visual skills that are necessary for pre-driving activities. Vision coach allows us to increase the patient's skills with vision, cognition, and visual motor activities. These abilities can be more easily addressed in the simulator or a dynamic environment, and this allows us to motivate the patient by the feedback that we get through the simulation. Feedback is always important to us for the patient to gain insight and awareness. And the simulator allows us to obtain this feedback at each scenario that we do with them. This is also good for the therapist in order to set functional goals and to demonstrate progress through the therapeutic intervention. A huge percentage of our patients want to address driving. So through the simulator, we're allowed to put them in a safe environment to address these pre-driving or community mobility goals that they have set and be able to work with them and decreasing anxiety for a lot of these patients who usually have some issues going back to driving. The beauty of the Drive Simulator is that it allows us to look at all of these abilities that the patient needs to return to driving and to assess those as we work with them and get them to that goal of returning to driving.